Which of the following is not a risk factor for gestational diabetes? A. Asian ethnicity. B. High blood pressure. C. Prior birth of a child with a congenital disorder. D. Newborn weighing 9 pounds 2 ounces. E. Advanced maternal age. The answer is A. Asian ethnicity. Asian ethnicity is not considered a risk factor. Hispanic, Native American and African American ethnicities are considered risk factors for gestational diabetes. Others include maternal obesity, previous pregnancies with gestational diabetes, delivery of a very large baby, and a family history of diabetes. A woman arrives at the birthing center for evaluation. She thinks she may be in labor. She is multiparous and experiencing contractions every 3 minutes. Upon examination, the nurse notes that she is 5 centimeters dilated and 50% effaced. Which stage and phase of labor is the woman experiencing? A. Stage 1, Phase 1. B. Stage 1, Phase 2. C. Stage 2, Phase 2. D. Stage 1, Phase 3. E. Stage 2, Phase 1. The answer is B. Stage 1, Phase 2. The woman is experiencing the first stage labor in the second phase. The first stage of labor exists when the woman's cervix is dilating from 0 to 10 centimeters. The second phase of the first stage occurs during dilation from 4 to 7 centimeters and when the cervix is 40 to 80% effaced. The second stage of labor is when the cervix is dilated 10 centimeters until the delivery of the baby. The third stage of labor is the delivery of the placenta. The first phase of labor is the onset of labor until the cervix is dilated 3 centimeters. The third phase of labor is when the cervix fully dilates from 7 centimeters to 10 centimeters. The nurse is called to a room by a laboring patient. The patient complains of a backache and appears restless. Her fingers are trembling and beads of sweat fall from her forehead. The nurse suspects she might be experiencing which stage of labor? A. Stage 1, Phase 3. B. Stage 1, Phase 2. C. Stage 2, Phase 2. D. Stage 2, Phase 1. E. Stage 3, Phase 1. The answer is A. Stage 1, Phase 3. During the third phase of the first stage of labor, the cervix dilates from 8 to 10 centimeters and effacement reaches 80 to 100%. The woman will be less able to focus on other things and may require more support from support persons. Labor may progress quickly and the nurse should be preparing for the second stage of labor, in which the cervix is fully dilated at 10 centimeters. Andrea comes to the office for a prenatal visit. She mentions that lately she has been excessively hungry, thirsty, and very tired. Which of the following would the nurse suspect? A. Gestational diabetes. B. Toxoplasmosis. C. Anemia. D. Parvovirus B19. E. Preeclampsia. The answer is A. Gestational diabetes. Polyphagia, excessive hunger, polydipsia, excessive thirst, and polyuria, excessive urination, are 3 hallmark signs that point to diabetes. While increased fatigue is common in pregnancy, combined with the other 2 symptoms, it may be concerning. Preeclampsia involves elevated blood pressure, swelling of the hands and feet, and protein in the urine. Toxoplasmosis results from infection by a parasite and can affect fetal development. A amniocentesis is performed to diagnose the infection of the fetus. Depending on the suspected duration of infection and the gestational age, drugs may be administered to decrease the chance of the parasite from infecting the fetus. Anemia and parvovirus B19 are unlikely to cause all three of these symptoms occurring together. All of the following may trigger asthma in a pregnant woman except A. Moist hair. B. Esophageal reflux. C. Stress. D. Animal dander. E. Unwashed sheets. The answer is A. Moist hair. All those listed may be asthma triggers with the exception of moist hair. Typically, cold air may trigger asthma exacerbation. Additional triggers include exercise, respiratory illness, smoke, and mold.